Okay, so I think it's a few minutes past one now. So if we get started, Rob, you've hit the record button. So if anyone joins us later, they can watch it on our website, can't they? Any bits of information that they've missed. So thank you all for coming today to be part of our webinar with information for employers around the role of the pharmacy technician, where we fit with the GP Ready programme and how we can help embed and support that role into general practice. My name's Sam Howard. I'm one of the clinical leads for the Greater Manchester Training Hub, and I'm leading on the GP Ready programmes, specifically for our AHP colleagues and our multi-professionals. So I am actually a nurse by background, but I love general practice. I only trained to be a nurse to be a general practice nurse. So I've spent a very long time in general practice, and I started my life off as an apprentice. I've completed 2 apprenticeships and subsequently became an advanced clinical practitioner, completing my master's a few years ago. So I've got lots and lots of experience of all the different avenues and wormholes and rabbit holes that are within general practice. So hence why I'm so passionate about it, still so passionate about it, and just jumped at the chance to help lead the GP Ready programmes for our other non-medical and non-NMC colleagues. So if we go to the next slide, and I'll introduce our team. So it's predominantly started off with myself, so the idea of how this could fit, and we've snowballed along the way, and there's a couple of people in the room that have been recruited in different capacities who are present, who'll be, I'm sure, really pleased to see their name up in lights, as it would be. So we've got one of our clinical pharmacists who's kindly offered to help deliver an input into the programme, who's Sian, who's with us today. Cora, who is another ANP by background, who has got a massive experience around advanced practice and general practice as well, who helped bolster this along. Sarah, who's also in the room, who is a registered nurse in adult branch. For those of you wondering what RNA is, it's nothing to do with vaccines or its development. It is an NMC terminology which specifies which branch Sarah specialises in, which is the adult branch. We've got Ricky, who is a physician associate. And we've also got Dr. Kelly, who isn't in the room today, who's a GP and a medicines management lead. So we've got this really good mix of skill who've all fed into and critiqued a programme so that we can really make sure that we get the best and offer the best for our pharmacy technicians, and to ensure that they're amalgamated and embedded into practice so that we can offer you as employers something really worthwhile, something that's really useful. And that's one of the things that I'm really passionate about. Is attendance doesn't prove competence, does it? And it doesn't necessarily mean that when we hit the ground running, or in practical terms, it is of true benefit. And that's where I feel really passionately about. And anyone who works with me or knows me, who's been on any of the courses that I've spoken on or helped develop, will know that I always come about things from a functional point of view and a practicality point of view, because I'm always based on the ground running and with that aspect. So that's always the stance that I'll take. So the GP Ready programmes, so there's different arms within the GP Ready. So the pharmacy technician is just one of those streams, and we've also got a purpose-built bespoke course for physician associates, which is led by one of the colleagues previously mentioned, Ricky. And we've also got a first contact practitioners work stream as well, led by one of our fantastic FCP leads, who's Judith, who's just amazing. So this makes up the full suite of offers that we've got for our GMC, NMC, and other allied healthcare professional, multi-professional diverse team that we've got. And the purpose of the General Practice Ready programmes is to optimise everybody's potential. So that we've made these really bespoke programmes looking at what people could do, what they are doing, what could they do, what should they be doing, and how can we get them there along that journey so that we've got confident and competent clinicians and professionals. And to thread that through to make sure that everybody's got the same offer and the same structure and that same foundation, we felt really passionately and strongly that we should have an adequate induction, some really good peer support so that you know that you're not on your own in general practice, because you all know that we've all worked in general practice and we've all been, that's why we're here today. General practice is an amazing place to be, but that amazingness on the flip side of that autonomy in practice can often be isolating, and it can often make people feel that they're on their own and working in silos. So we really wanted to make sure that we had that safety net around those professionals, that we could have those groups to help make sure that you can share any concerns you've got and work through any problems. Within this particular GP Ready programme, we have got some clinical training as well. And we've also embedded throughout all the programmes some quality improvement, because we just feel everybody should be allowed to develop their practice and improve practice. And without any data or something to measure it by, you're just someone with an opinion, aren't you? So the only way to truly evidence that you're making an impact really is through some kind of quality improvement cycle, so that we can evidence our work. And we thought that everybody should be able to do that within their day-to-day job, irrespective of background. And I think leading the way for all these programmes has been the GPs, really have led the way. So they were the first discipline that had a fellowship, as it's called, a national fellowship. And we've taken some of the learns from that. So you'll see that it's filtered through, and you'll see commonalities throughout all of the programmes, because we're really working at scale so that we can offer this standardised approach that we're training to our professionals in general practice. So a brief overview of some of the topics that we'll be covering. So it's a sessional weekly programme. And as on the first slide, it starts on the 23rd of November. But what we envision is that it'll be a rolling programme, because life isn't that straightforward, is it, that we can just have a start and end date. Within employment, you've often got references to come in and adverts to get out. So we wanted something that you could hop on and hop off, and equally make sure that it was really fit for purpose. So all of our programmes start with an induction. So you've got to meet the team, so you'll know who we are, what we do, who to access, who to ask questions, and where's the best place to ask those questions. And then we thought it through as a kind of logical programme where it builds up skill week by week, where they would start off. And one of the things that I thought I was quite mindful of is some of our pharmacy technician colleagues that are coming into general practice, they're often IT based, I've found, and that isn't the absolute rule, but frequently it's quite an audit process role where they can extrapolate data, interrogate systems to a certain extent, find those patients at risk of something. But actually what we found really interesting is they actually quite like patient contact, but it's a skill in itself, isn't it, now that it's communicating with patients. And I think other than leaving ourselves on mute within a Teams meeting, is a difficulty of how can you keep a consultation to 10 minutes or 15 minutes on a telephone where you haven't got those body language cues, those non-verbal cues that can kind of wrap up a consultation that we'd be familiar with. And it's really those practical skills that would make someone feel confident and competent. And then bolstering onto the existing skills around audit and identifying potential safety issues, I suppose, that have been flagged nationally, would be how do you find that information from the clinical system, and using the different systems that we've got across GM would enable those technicians to extrapolate data. So they're not just extrapolate it, but do something with it. So thinking it through from start to finish, how can we embed a system that would be really useful and really robust, so that your computer isn't just prompting you every time you try to prescribe something with boxes that clinicians then just switch off because we get bored. I'm definitely guilty of that, and I'll hold my hand up. But actually leaving something behind that has a legacy effect. So it's not a fire and forget. It's something that we've got that's sustainable, that improves patient safety. And it isn't just about generating a list of patient names who need to be reviewed for X, Y, and Z, or en masse need one drug switched into another drug. That's not best patient care, is it? But so building on that patient contact, which might be quite new territory for some of our pharmacy technicians, would be around how we get the best of information from the patients, that we could risk assess what it is that the patient most likely needs to reduce their risk, and who then they need to see as well. So it would be looking around a biosocial assessment. So what are the determinants of health, lifestyle modifications that would be needed, anything that's modifiable and non-modifiable risks. So then picking them out so that we can then put a robust plan in place to reduce that patient's risk. Any health and wellbeing, we thought that would be fantastic for every aspect of our programme. So we've now threaded that through all our GP Ready programmes, and we're working with our GM colleagues. So we've got this sustainable and standardised approach. So we've not just done something on our own back. we're working with the GMs so that we've got this rollout programme so everyone's got access to some kind of support, because we've all been working in practice throughout the pandemic, and it has taken its toll. So what we really want is this robust and resilient workforce. We then included some clinical skills, and I was conscious of this might then look like a healthcare assistant course, but it was actually to reassure that it isn't. And the similar skills that could be seen by any of our clinicians in practice, because equally it isn't just a healthcare assistant course. You could argue this is a nursing course because there's that similarity. It's a general practice course. It's the skills that we need for our clinicians who could be patient facing and what they might use to adapt to absolutely make sure that every patient contact counts, and to get as much as they can from that contact so that they're optimising that patient review. And I think it ties in, it doesn't duplicate, but it ties in and it complements some of the other courses that pharmacy technicians can undertake, such as CPPE and the diploma as well. So we've worked really carefully so as not to duplicate. We've included some venipuncture skills as well, because it might be that your pharmacy technicians, for example, they might be working within frailty. They could be out in the community in patients' homes, or they could be in the care homes, where you might want to reduce the risk of people going in to see them. So it might just be really useful to have that one person making contact. And equally so, it may be that you might want to do an audit around DMARDs, so your disease modifiable drugs, and making sure that the monitoring is in place correctly. And we've seen over the past 18 months that we've had to pause blood testing for various reasons, be it that the patients, by virtue of them needing that blood test because they're at risk, because of the drugs that they're on, has actually made them not want to go because they've been assessed as being clinically extremely vulnerable. In combination with a national shortage of blood bottles, we've got various reasons why this would be a fantastic opportunity to make that contact count if you've got the pharmacy technician reviewing that patient to make sure that everything's safe. To follow through the advanced IT skills, we've included a practical session to get everyone thinking about how you could embed that MRHA alerts into practice, so that we've really got that thinking about embedding change and that some of that leadership work as well. We're then covering a few of the long-term conditions. So it's an overview generally, but then there's some disease-specific work as well, so that as a network, as a practice, whatever you deem that this person would be really useful to pick out any kind of project work that you think, and they could really get teeth into it and to make it really an exciting role for them to have too. I can't really speak enough about frailty and deprescribing. That's something I think should be top of everybody's list. So it's understanding their role within that and how they can have an impact to improve patient care and safety. We're looking at some of our group consultation work, and again, this has been another one of the common themes that's been kind of threaded through all of our GP Ready programs, because this has been increasing in popularity over the past few years, but it's never quite reached its full potential, and I suspect the pandemic has hindered that a little bit. So it's making sure that our whole team are aware of its potential so that we can optimise its outcomes. So then from a practical point of view, we want to make sure that everyone understands what the quality outcome framework and the directed enhanced services, and what were the pharmacy technicians fit into that as well, and what the potentials are, what the relevance is. Because anybody that's coming into general practice, to say that it's a learning curve is a real understatement, isn't it? We've all been there if we've been new to practice, and some of the biggest shocks to the system would be the quality outcome framework and any enhanced service, understanding why we're doing that, what's that for, what's the purpose, so that we can really make sure that we're doing things with reason rather than just ticking boxes. We've tagged on to the end some immunisation and vaccination training, so that we can make sure that we've got this really solid, robust team within primary care. With the continuation of the COVID vaccination schedule, we know that our workload has massively increased, so it's just making sure that everybody's as skilled as they can be. Again, we've got some more leadership and development, and the quality improvement classes have specifically, we've been working with AQUA, so we've got this standardised approach so that everyone's got that national accredited kind of access to the training. So the benefits to you as an employer on top of all that free training that we're offering, that is totally accessible to anybody that's on the within the hours roles, that's a pharmacy technician, is we have got a clinical supervision resource, and it's a topic in its own right. So you need to contact your local training hub contact, which would be, if you're in Bolton, and within that is myself, but for the other areas, I'll signpost you to our website or to Rob. Rob will pick that up with you, and we can send you some information as to how we can help, because clinical supervision in practice is absolutely paramount for patient safety and for clinician and professional safety, and it really should punctuate the working week. But with that said, I recognise how difficult that could be, so any help that you can have to make that happen is just a must. With all the training that we've got, which again is free from the training hub through the partnership, it helps embed the role into practice to make them really confident and competent professionals. We just want to relieve some of the practical training burden, so that you know that your clinicians don't have to then spend time with X, Y, and Z. You can tap into our resource, that you know that there's a wider group undertaking that training too, so it's not just a one-off. And then they can feed back in, and anything that you want to make comments and suggestions, feedback's always welcome. We always welcome out the training hub, definitely from everyone on the ground, because it's real life working, isn't it? We wanted a standardised approach to the development of this programme, but also the continuous development, which is where the feedback comes into that. And I think some of the comments the feedback that we've had has been that we've put a lot of time and effort into this, and it really is quite comprehensive. And I think it really evidences that our aspiration to make sure that every person is optimised. I think this is a really good example of that. The opportunities that are available to a pharmacy technician, and that their abilities in practice are vast, so that they're this really, really useful professional that we could have access to in primary care. So that's a real whistle-stop tour of the programme. Do you have any questions? Or do any of my colleagues like to make any comments of anything that they think I've missed? Is there anything in the chat, Rob?
Nothing in the chat yet. We had one question that came on an email, so I may as well ask you here. It was, because that way everyone gets the answer. Are pharmacy technicians employed by a CCG able to access the course?
They can access the course, but they might not be able to access, or they need to work locally with their PCN around the supervision offer, but they can access the course.
Fantastic. And then we have got a raised hand. Is it Vish?
Yeah. Hiya. I just wanted to check, first of all, how long is the course? How much study time would it take out of practice for the technicians? And is that money per technician, or is it per PCN?
That's a brilliant question, Vish. Thanks so much for asking those two questions. That's really good. So any financial resource that we've got is for the network. So the roles that we're specifically targeting and working with are employed at network level. So we haven't got unlimited funding, so we needed to kind of have a mathematical equation to work to. So what we do know we have is 67 networks across GM. We have no idea how many of the reimbursed roles are actually employed, so we couldn't utilise that figure. So we needed to be able to offer something that was specific. So in doing so, it did need to be at network level. So it isn't per pharmacy tech, it is per network. The sessions are typically about 3.5 hours, 3 hours a week, but there are 3 days that are full days definitely as well. So we can send you through the specific programme to count up the certain hours, Vish, and it lasts for approximately 20 weeks now, Rob.
17 weeks plus the aqua. So the aqua is a bit different because of the provider. It's spread out over the longer term. So there's like 3 sessions for that, plus 3 more if they want to go to for action learning sets.
Fabulous, thank you.
Carol?
So the presentation was really clear of the benefits to the pharmacists, pharmacy technicians themselves, Sam. But what do you see as the really main benefits to an employer? So what's the practice or the PCN going to get out of putting their staff on this programme?
I think it would alleviate the time around supporting the pharmacy technicians to a certain extent, because we've taken quite a wide group of people that we've fed into the programme. And as I've always said, we'd love feedback to think of what the opportunities are. And we've drawn upon some of the experiences from some of the most experienced pharmacy technicians in the north, who lead their own clinics and things around INR monitoring and management. So that they've been in post for quite some time. So it's trying to problem solve before it gets to be a problem for the network, so that we've got that experience to say, these are some of the skills that you will find really useful. These are some of the ideas that you could embed into practice. This are the support mechanisms that we've got, so that your professionals will feel confident in practice, so that we can help to make sure that their attainment is really at quite a good level. Because what we have seen for some of the reimbursed roles across GM in no particular area, it's been quite widespread, is that changing culture to general practice. Because we are a specialism in our own right, it has been a culture change. So to have this robust support mechanism around induction, peer support, some assistance around what supervision could look like, and the additional patient-facing and non-patient facing upskilling, it alleviates that pressure in practice, so they know that we've got that covered almost. We can, alongside the mandatory training, they've got something that's set, a programme that's set with certain outcomes that they can tap into, and at the end of it, they'll have this set amount of skills. Chad, did you want to come in?
Yeah, I just wanted to add to that as well, was on, as a practice pharmacist on the surgery level, it's things like adding in the venipuncture, to me, that would be an absolute game changer. So to have a qualified technician being able to lead on the shared care, so things like the DMARDs, atypical antipsychotics, the diabetes reviews, making sure that people coming in appropriately for HbA1c, that means coming in when they need to, but also not coming in and not checking HbA1c on every blood test that gets done when they don't need to. So actually saving those HCA appointments. And then I would totally envisage that they would be able to lead on all of that, and then appropriately signpost upwards to your clinical pharmacist and to your GPs for your more complex patients, but they could absolutely lead on all of those. And I think that, with regards to the day-to-day work and also the QOF, would be really, really helpful, to say the least. It's really exciting, actually. That would be amazing, personally.
Carol, do you have a follow-up?
Yeah, just on the back of something you just mentioned, Rob, in terms of the Aqua programme, the research that they do, or the audit that they're doing, is that made in collaboration with the employer, or is it something that the pharmacy techs go away and look at themselves, or how do you come to the conclusion of what they're going to look at?
From what I understand, it would be the pharmacy techs working with the employer. So part of the quality improvement courses, it helps them to do a project, a small quality improvement project over the course of a few months. It doesn't need to be huge. It isn't a huge in-depth piece of work. So it could be within their own workstation, or if there's something within the PCN or the practice or whoever their employer is that they want to be looking at, then they can use that training to do that project, that quality improvement. If there's nothing specific within the wider area that's required for the moment, then they can look at something small within their own workspace of how to improve them. So the project with Aqua can be scalable from really small to really big, just depending on what's needed, and they can work with their employer to do that. Fish.
Sorry, me again. So I just wanted to ask about, in relation to the CPP pathway, do you have a prerequisite they need to be on module 2 or 3 before they start it? And can they use the same QI project for their pathway that they can use for this? Aqua thing, just conscious that module 4 and 5 is the QI project, module 3 is clinical skills, and 2 is upskilling clinically on conditions. And just, yeah, sorry, I'm a bit confused.
No, there's no prerequisite of any attendance, because we don't know where the pharmacy technician will be in relation to the CPPE qualification. So we just needed this standardised programme. So it could be that they've completed it 2 years ago. They might not have started it. They could be halfway through. And that's one of the reasons why the benefit of a step off and step on approach was beneficial. Because some of the things that we'll pick out are specifically just general practice skills as well. So that's why I always open with it's a really practical approach to the training too. Around the QI modules, I think it would be probably quite savvy to utilise any common themes of quality improvement programmes to write up either for Aqua or for the CPPE. But that is it is an Aqua programme, it's not ours, Vish, so I can't see there being a problem with it, but equally it's not my decision to make, if that makes sense.
Yeah, thank you.
Sian?
Legacy hand, sorry.
Any more questions from anyone? Oh, Carol's come back.
Sorry, just a bit of a help from everybody that's on the call. I know that we're tweeting and we're using Facebook and we're using our website to try and get this message out. I'm just wondering whether Chris would be able to share our Twitter account info so that if people see the tweet, they can reshare them for us so we can get everybody on this programme. I think it's a brilliant opportunity, and it would be a shame if people are out there and not accessing it.
I'll drop our Twitter handle into the chat box.
Rob, if you could put the Training Hub's website link in there too, and any other questions that you've got, if you want to have a signpost to the website, you can have a look, or you can drop us a message through that mechanism as well, and we can pick up anything later on. Rob's really really efficient with that, so you'll always get a really speedy reply because Rob's really hot on that.
Can I just check, has anyone sent it to CPPE? They send out a bulletin for everyone on their pathway every Thursday for every person enrolled. It might be worth getting it put on there as well.
Thanks, Vish.
I'll just put the website and the email address in the chat.
Okay, that's great.
Yeah, so thanks very much for coming. Sam, do you want to close with anything?
Well, thank you all for coming, and keep the questions coming or any comments. Love feedback, love questions. It just highlights that you've been thinking about it, really. So thank you all for coming, and we'll hopefully see you all again soon.
Oh, thanks, Sam's great.
Thank you.
Thanks, Sam. That was good. Excellent.
Thank you.